It's important to understand the risk factors for ED, behaviors, and other medical conditions that could predispose the patient to having this problem, just to get a global sense of the patient's overall health and what are we doing to help this person stay healthy. Diabetics have problems both in the blood vessels in their body that carry healthy blood to places like their fingers or toes. That's why they might develop disease of those organs that relates to poor blood flow. Alongside that, though, diabetics, especially when they're poorly controlled diabetics, will have disease in the nerves that are responsible for sensation in particular, but sometimes also function. The penis functions normally in terms of getting an erection through nervous system signals that tell it, hey, it's time to do your job. And then blood flow that as a result has to increase by a tremendous degree. So along those same lines, yes, we do have people who have neurological conditions where, again, a change in the nervous system function is what causes their erectile dysfunction. Certainly any of the diseases that cause injury to arteries doing their job normally, things like peripheral vascular disease, coronary artery disease, high blood pressure. So smoking causes injury to these same healthy blood vessels, and as a result, the patient who is an active smoker will notice far more rapidly a deterioration in his erections if he starts to develop this problem. Other important lifestyle risk factors, certainly poor exercise habits, poor diet, excess alcohol consumption. These are all things that can contribute to an increased risk of ED. And then amongst a urologist practice, treatment for urology cancers like prostate cancer, bladder cancer can sometimes set the patient up to have these kinds of problems. Mental health issues like depression or anxiety can certainly predispose the patient to ED, but alongside that, unfortunately, many of the treatments we have for depression or anxiety can also cause these problems. Sexual dysfunction along the lines of a change in the patient's ability to have an orgasm, a change in their interest in sex, erectile dysfunction. I have to remind patients, look, it's not as simple as us saying we're just going to stop whatever treatment it is you've been prescribed. Instead, we have to take a team-based approach with your mental health provider in terms of coming up with a treatment plan that isn't going to create these problems to such a large extent. And as well, I may very well have to offer you treatments in order to try and solve these problems. Healthy habits at a young age is a great idea. It is a great preventative strategy, both for sexual dysfunction complaints and for other health issues. And if that's having a consistent exercise plan, if that's healthy eating habits, a diet that you're comfortable maintaining, as evidenced by your weight's under control, smoking, that's a big one, alcohol in moderation, and engaging with a physician. I'm always encouraging young men to identify a primary care doctor who they're comfortable with and start that relationship now.